Joining me now to discuss all this is Dr. Sanjay Jain, a board-certified physician and author of the book Optimal Living. Doctor, it's great to have you with us.
It's great to be here today.
All right, so we were talking about this travel ban just a few seconds ago also with Harvard Law professor Alan Dershowitz, a famed civil libertarian guy. He says, yes, there could be a situation when you have a public health crisis of this nature that travel bans are a necessity. At this particular point where we are in the Ebola epidemic, what is your take?
I actually support travel banning. If you look at many of the countries in Africa, they actually have travel bans. So the United States actually has not done that yet. We have to really think about that.
Now, we also heard about, the criticism that there's been towards the Obama administration for a lack of a clear, concrete, comprehensive plan on how this nation is actually going to deal with Ebola. First it was, we don't have anything to worry about necessarily. Then, oh my gosh, we have a case here in the United States, but it's not going to spread. And now it has spread here on U.S. soil. Would something like laying out a very clear and specific travel ban help this administration at least present more of the idea that they have their hands around this?
You know, that's part of the solution. I think the checkpoints and airports are helping, but not good enough. People who are coming into this country without fevers are coming here getting fevers later. So we got to really have measures to take control at various steps. So travel ban is one way to do it, but also these checkpoints. You got to really be up against these checkpoints, getting temperatures correctly, but that's not good enough. So if you look at these countries in Africa, South Africa, they have a travel ban in their own country, in their own continent, and they're not getting, I don't hear any case in South Africa, but we're getting case here in the United States. Isn't that kind of odd?
So they're in place in Africa. Do we know of a travel ban that's ever been instituted in this country that's been effective?
I haven't heard of one, but it doesn't hurt. I think you got to try everything you can. And I said before in the show, keep it on that side of the ocean. Why are we bringing it here? It's almost like we're asking for, fight it, and it doesn't make sense to me.
Now there you have a doctor and a lawyer, Professor Dershowitz and Dr. Jain, both advocating for this travel ban. So you got to cover it from all perspectives there. Now, something else that's been floated here, we know that over time, viruses have a tendency to mutate and evolve. Is there any more chance today, based on what you've seen, that the Ebola virus could become airborne?
Right now, no. There's 5 strains of Ebola, so right now none of these strains are airborne, but that's a concern. So we have this lady in Dallas, a nurse, who got the virus. We don't know how. She says she broke protocol, but what was a protocol? She was pretty much well equipped in terms of her protective gear, so it's really puzzling how she broke protocol. So if she's getting broken protocol here, there's a lot of questions, and the mutation you asked about, it's certainly possible, but at this point it's not airborne.
Okay, and you don't believe, based on anything that you've seen, that there's the chances are growing that it could become airborne?
Not yet, and I never want to say never, but right now we shouldn't be worried about it being airborne, but we have to keep that in the back of our minds.
Okay, yeah, that nurse, one of 70 staff members to have contact with Duncan while she was working, and how, based on what we've heard here, how easy is it? Is it a matter of, I read some of the instructions on how people should disrobe after wearing one of these hazmat suits dealing with an Ebola case. You can't touch the outside of your gloves as you take them off. I mean, how difficult is this actually to do?
It's extremely difficult, and that's a problem. They get all this gear on their head, and these gloves, double gloving, and it's very difficult to actually deal with all this equipment, taking it out. So my guess is she probably got the Ebola virus taking the equipment out. In Africa, they actually spray you down. So I'm not sure if they sprayed her down with a disinfectant, but it's actually a problem. So all this gear, how are you going to disinfect this gear? Are we reusing this gear? So there's a lot of question marks, and we got a place like Dallas is actually supervised by the CDC. What about the community hospital?
Exactly, that was my next question.
In rural Texas, are they going to be equipped? I don't know.
And here we have this hospital in Texas, a huge metropolitan area, where you would expect them to be up on the latest technology, unlike some community hospitals around the country here. But do you think at this point, Dr. Jain, that there should be specific hospitals, say Emory University in Atlanta, the one in Omaha, Nebraska that's treating the NBC camera guy, and that also treated the Rick Saka, the other doctor who came down with Ebola. Should they put this plan in place right now that there are specific hospitals around the country?
They should, but that's not good enough. If you have an outbreak, that's not going to be enough hospitals. You got to get it all over every hospital possible. So 4 hospitals isn't good enough.
All right. Well, we'll talk a little bit more about this coming up with Dr. Sanjay Jain after the short commercial break. We have Ebola apparently apparently spreading, and a lot of questions out there from the public, and some concern, legitimate concern at this point. Much more to come here on America's Forum. We'll be back right after this.